How many grafts do I need for my hair transplant? I'm 23 years of age. I've lost 80% of hair in the frontal part of my head. My hairline is damaged and my hair is still falling from the upper part. I want to have hair transplant. I want to know how many grafts I need and which technique will be better, FUE or FUT.
Thank you for your question. You're 23 years old and you've submitted a photo with the top of your head, and you're asking about how many grafts you'll need, and you've also described that you're continuously losing hair. So I will explain to you how we treat patients like yourself when they come to our practice. You've already answered the question about your age and the degree of your hair loss, and it seems that in terms of overall categories of patients, you fall in the category of a younger person who's had an early onset and has a rapid progression. So I'll let you know, I'll give you an understanding of what the current technology is and what we do in our practice for someone like yourself. First of all, it's perfectly understandable that you are asking the question about how many grafts. When you do research online about hair loss, you're going to be seeing a combination of different options, but they fall into categories of oral pills and supplements, shampoos of various kinds, medications such as minoxidil and finasteride, and then a lot about hair transplant. And the hair transplant industry has been all about numbers of grafts, cost per grafts, and unfortunately there is not as much open disclosure about the limitations. So let's start with the situation you're in so you can understand why I'm saying what I'm saying. When you think about hair transplant, there is almost an assumption that you can fill the top of the scalp with hair from the back of the scalp because there's plenty there to do that. The reality is there isn't enough. Especially when you have this much hair loss, you don't have enough to make a significant enough difference to create the volume that is desirable for someone in your age group. As men get older, 30s, 40s, 50s, we refer to a concept called the rule of decades. In your 20s, 20% of your contemporaries have hair loss, like yourself, while 80% have a lot of hair. Now, many years ago, it was pretty much, and it probably is still, but it was never advised to really do hair transplant on young men in their 20s, especially early 20s, because there was going to be a lot more time of potential progression and likely progression to the point where it may be too difficult to provide enough grafts to cover the area that they desire. When you reach your 40s and 50s, 40 to 50% of your contemporaries have hair loss, and the needs of a man in the 40s and 50s or beyond are very different. And for example, for someone in their 40s and 50s, if they have a thin little spot of hair in the middle, it breaks up the top of the scalp in terms of the framing of the face, and it's acceptable and it's fine. It's a look, and a lot of guys totally carry that out very, very well. In your 20s, you want more than that. So I would say that I would not advise that you have a hair transplant at all. The options that you should look at are things to help stabilize your hair loss and prevent progression. Now, those options include finasteride, which is an oral drug. Chances are you've already learned about it, and what we're seeing in our practice is men in their 20s almost categorically do not want to take finasteride because of the fear of long-term permanent sexual side effects. This is based on studies done in the past few years that appear to demonstrate this to occur in a small percentage of men. But we're seeing in our practice that men in their 30s, 40s, and 50s are also do not want to take finasteride. The other option is something we've developed in our practice, and we call it hair regeneration. Briefly, this is a concept we developed based on observations made from the behavior of hair after the application of a wound healing material called extracellular matrix. What we have done is we have combined extracellular matrix with platelet-rich plasma. This is derived from your own blood and is like a catalyst with the active growth factors and cells needed for wound healing. When combined in a specific way, customized to you, and delivered in a certain way that we've developed a method, we're able to reverse significantly thinning hair and restoring a lot of volume and thickness. Now, much of this depends on what stage of hair loss you're at, how quickly your hair loss is progressing, and then there is certain other factors that we also look into individually. For example, people with coarse hair seem to do very well, mainly probably because the coarse hair covers more scalp. Ultimately, it's more about scalp coverage than it is about numbers of individual hairs. It's commonly accepted in our profession that when you first notice hair loss, you've already lost 50% of your hair. So your strategy should not, I would advise, be about transplantation. We have many examples of patients with the recent popularity of FUEs. We have patients who have come who have a limited amount of hair in the front after doing like 1,500 FUE grafts and then having progressive thinning in the top of their head, and it just looks strange. It doesn't look right. So with that understood, it is always better to have no hair than it is to look like you're pluggy and have scars. And this is something that we know this from 20 years of doing hair transplants of patients who have had them before and have either limited amount of hair available or get limited results. There are many factors that affect the outcome of a hair transplant, but since you're so young, my advice is don't even consider a hair transplant. Look into the options of medical therapy, hair regeneration, learn more about it, and then decide what areas to pursue and to try. But unfortunately, time is not on your side, and you need to make decisions sooner rather than later. With hair regeneration, we know the earlier we treat someone, the better the results are. And we've treated men as young as 18 years old who have the onset very early based on a family history and a pattern. And I can say I've been able to stop it and re-thicken the hair very quickly as long as we caught them early. The earlier we catch someone, the better it is. So, that being said, I hope that was helpful. I wish you the best of luck, and thank you for your question.